That number, to me, is more than I thought.
Dr. Mark Briesacher is the chief of physicians for Intermountain Healthcare.
There's the passion of wanting to help people and the discipline around making sure that what we're doing is the right thing.
He says it is taking some time to get physicians educated about marijuana and ensure policies are up to date with the law.
You want to help people. And look, we're absolutely committed to this.
Medical cannabis advocates question if Utah's healthcare companies are moving fast enough, especially for patients where time isn't on their side. They say the numbers are a drop in the bucket to the thousands still out there trying to get letters.
We have a program that is set up, born in fear, designed to fail.
Christine Stenquist is the founder of Together for Responsible Use in Cannabis Education. She believes the law doesn't offer enough protections for doctors and patients.
We're having a real issue in this state with how our legislation is written, and there really isn't some education going on for our medical community.
Dr. Briesacher says he understands the frustration.
From the perspective of patients, I definitely see how this is concerning to them. And I also have heard from our providers about how they really want to understand this.
This is a brand new medication, as it were, right? This is something that hasn't gone through the FDA process.
The Utah Medical Association, which opposed Proposition 2 and helped draft the compromise legislation, says patients do need to be patient.
So like any other medications, you're going to be slow right out of the box to use it.
McComber points out cannabis is not a cure. It's a treatment option. Sometimes physicians need to make sure it doesn't conflict with other medications.
Because a patient wants something doesn't mean that it's necessarily appropriate, and that's going to be something that the patient and their provider are going to have to determine.
Dr. Talbot says physicians do want to help their patients.
You cannot force physicians to practice any certain type of medicine or to make available any specific therapies. All we can do is encourage them, educate them, and try to protect them.
The McClellans were forced to look for a new doctor and finally got a letter for Leah. They say it's made Leah's quality of life better.
Wow, a lot. So, seizure control, we don't have to use rescue meds anymore.
In March, the law will change again. Right now, those affirmative defense letters help patients avoid prosecution. Doctors can write an unlimited number of recommendations. Once Utah's medical cannabis program gets up and running, they go away, and doctors will have caps on how many patients they can take who use medical cannabis.
A GP can only write 175, a specialist can write 300, and then they're capped out. Then they say that you have to go through all these hoop jumpings. No doctors are wanting to get involved in this.
This is like gold, yeah. This is amazing.
After 6 tries, Krista Bowers got her letter, and she says her CBD oil is helping her. She'd like to see other doctors step up and make recommendations.
People shouldn't have to go through so much problem to get medicine. You know, if I'd asked for an opiate prescription, I'd had one.